with you.
Stress is a normal thing, it's a good thing. Now becomes too much for the person to handle. This is where we start having mental health issues.
Nervous system, and so on. Which of these
Yes.
systems attached to this mental health?
Neurological system, it has to do with the brain. Talk about mental health in simple terms. It is the state of your mind. It is affected. Every aspect of your life is also affected. It is easy for them to appear normal but fail to act. It means that you are now leading yourself up to have a mental health disorder. People now tend to ignore emotional stress, low mood for a short period of time, and then you bounce up again.
In that case, you can't say I'm depressed.
Yes. No. You're having low mood. Other ones are feeling of guilt, isolation. We advocate is healthy connection. You should have trusted family members or friends that you can be able to talk with. Now, these are people that are not going to judge me. Sometimes I ask some patients, how are you enjoying Nigeria? And they're like, oh, they're stressed out. Who is not stressed out in Nigeria? And that's true. Nigeria is a really stressful country. But now, the question is, how are you coping with the stress? Avoid negative coping mechanisms. For it to become too much, come to the hospital, meet mental health experts, understand you. You don't have to wait until it's so bad.
Hello, doctor. Good afternoon.
Hello. Good afternoon.
Yeah, good to have you here. I'm honored to have you here.
The pleasure is all mine. Yeah. Good to be here.
Before we dive in, doctor, I would love us getting to know you more. So I would appreciate if you introduce yourself and tell us more about you.
Okay, so my name is Dr. Kizzito. I am a medical practitioner, a medical officer. I work currently with Limi Hospital in Abuja. I'm a mental health enthusiast and have desire to, specialize in mental health. But, 5 years, 5 years in the practice now. Okay, what am I saying? A little above 5 years. I say 5 years plus. Soon now it will be 6 years. So yes, I'm really passionate about talking about mental health because people are not really so knowledgeable about it. And then there are a whole lot of we like call it bias. When we talk about mental health, we have lots of bias against it.
In very simple terms, I mean, I will appreciate if you can explain what mental health is. I want to understand what mental health really is.
For some people, they believe that mental health is just simply absence of a mental health problem, issue, or disorder. But mental health is a whole lot bigger than that. What do I mean? What I mean is that when we talk about mental health, we're talking about the psychological, we're talking about the emotional, we're talking about the social well-being of an individual. In fact, I dare to say that mental health of an individual is by far the most important aspect. Why do I say so? When we talk about this mental health, we are talking about how do you think? How do you feel? How do you respond to stress? How do you cope with stress? How do you relate with yourself? How do you relate with people around you? Okay?
Yeah.
If we are looking at it in simple terms, when we talk about mental health, we are talking about the mind, the state of your mind. When we talk about mental health in simple terms, it is the state of your mind. So it's that state of your mind that will determine how you think, how you feel, how you interact with people, and then how you are able to cope with stress. So, when I was telling you that mental health is something that determines a lot of the aspects of your life.
Right.
Because if it is affected, every aspect of your life is also affected. You understand? That is why you hear people say, this or that is affecting my mental health. So when they say that, they're talking about their state of mind, they're talking about their psychological, social well-being.
All right.
So mental health is just the state of your mind. How do you feel? How do you react? How do you manage stress? How do you relate with the people around you? That is simply what mental health is.
Okay, and doctor, if I'm right, I think we have like 10 major system in the body, if I'm right, like on
Yes,
skeletal system, muscular system, cardiovascular, nervous system, and so on. Which of these
yes.
systems attached to this mental health?
There are two ways to look at it.
Right.
Now, when we talk about mental health, we are talking about it's the neurological system,
All right.
right? Because it has to do, a lot of it has to do with the brain. A lot. And why mental health is a bit challenging is that is for example, somebody has heart failure,
Mhm.
you're going to see certain symptoms like the person has difficulty in breathing, he has leg swelling or abdominal swelling, which people call tummy swelling,
All right.
and things like that. You know that okay, your heart might be affected, your heart might be failing.
Mhm.
But now, mental health is more or less all encompassing in the sense that it covers multiple systems. And then it is easy to hide the symptoms or the features that people have, when they have mental health issues. It is easy for them to appear normal in quotes,
Mm.
right? And more or less even take it for granted. Because if, for example, I'm having food poisoning, I'm passing loose to, and I'm having abdominal pain, you can easily tell. You might just see me bend a bit and you now
Yeah.
ask me, Kizzito, what's wrong? I'm having stomach pain. Then you can now tell me, okay, I'll go to hospital now, let them give you something. But when I say mental health is all encompassing, it is primarily it involves the nervous system, the central nervous system, the brain,
All right.
and all the parts of the body that it supplies. But then it also involves the mind. And there, in the two, there's this argument, where exactly is the mind? When somebody says something, this thing is affecting my mind, where can you point and say that this
Grounded.
is person's mind? Some people point to their hearts, say, they touch their chest and be like, my mind
Mhm.
was affected. Some people touch their heads, right? That has always been the debate. It's multi-systemic, but if you want to be specific, it affects the nervous system.
Nervous system. Right. So, doctor, you said something like someone can be looking good outwardly. Maybe you are doing so well in life and still battle with poor mental health. Is that possible? And how are
Yeah.
you able to identify such a person in one? Two, if you as a person having such issue, how are you going to know I have a mental health issue?
It is very common for people with mental health issues
Mhm.
to appear normal, or not for people around them to not be able to detect it. So, but before I go further into it, I want to talk about stress,
Okay.
because stress is one primary aspect of mental health. What is stress? Stress is just any form of effort, any form of effort that one puts in. That is stress. You climbed a mountain, you can say, "Oh, I'm stressed." You went to work, you can say, "What? I'm stressed." It can be physical, and then it can also be emotional.
Mm. Emotional stress.
Yes, you can have emotional stress. You went outside and you did nothing to your neighbor, and your neighbor just insulted you, and you're feeling angry, you're feeling sad. That is a form of stress. So when we talk about stress, people only relate to physical form of stress.
Right.
You carry load, you went to work, you were transporting yourself from one geographical location to another. But people now tend to ignore emotional stress, because why people ignore emotional stress is that it is not really something that you will quantify. Take, for example, pain.
Mm.
How do I quantify pain? How do I compare my pain with your pain? Like, what is the yardstick that you use? But when we talk about stress, physical stress, it is something you can relate to. Take, for example, I ran 1 kilometer. The other person ran 2 kilometers. The other person ran 3 kilometers. You can say that the person that ran 3 kilometers is more physically stressed. Stress, is stress a good thing or a bad thing? So stress is neither It's not a bad thing. Let us understand that stress is not a bad thing. In fact, without stress in your life, in a way, life begins to lose its meaning.
Mm.
So stress is there, both physical, emotional. It's a good thing. She has different ability to manage stress. Some people have a high threshold. Some people have a low threshold. A common thing we can use for comparison is men and women. Men generally have a higher stress threshold. Women generally have a lower stress threshold.
And
This does not mean that, yes, this
why
does
is
not
that?
mean
Is it
that
because
all
of
men,
hormones or what?
okay, hormones play a role, strength plays a role, and then just historically, it is just the way it has been designed that men are
Mm.
generally able to adapt to stress more than women. But remember, there are exceptions to the rule. There are women too that can handle stress more than men,
Right.
and there are men that cannot handle stress as much as women too. So when the level of stress that you're going through becomes too much for your body to handle, then that is when we have a problem.
With you.
Stress is a normal thing, it's a good thing. But when the amount of stress that one is going through now becomes too much for the person to handle,
Mm.
remember this is it is more or less personalized. Like me personally, I can handle lots of stress. The same thing I would do and not complain. Lots of people will do it and they will be like, "Oh, I'm really stressed. This is really stressful for me." So everybody is personalized to everybody. Now, people now find it difficult to cope when the stress level that they are going through is bigger than what they can handle.
Mm.
And that is where we start having mental health issues. Some people, I can give you an example. Someone will tell you that me, once I've worked 8 hours, that is it. I just clock out. Then me, I can tell you that I can work for 24 hours. I can work for 48 hours. I don't
Right.
mind. And I'm able to handle it. And you will not even be able to tell that I've worked for 48 hours. So it's personalized. If you notice that the amount of stress you're going through is more than you can handle, then you have to find ways to cope. And when people are now finding it difficult to cope, you now have mental health issues. You now have things like burnout. When we talk about mental health issues, they are now, I want to classify it into two now. You have mental health disorders. These are the ones that when
Yeah.
somebody has, you now know that it is very important that this person has to see a mental health specialist. And then there is one that is not a mental health disorder, but the person is having mental health troubles. The person is finding it difficult to cope. The person is stressed out. So for this group of people, so before we get to mental health disorder, usually they have a time period where they have noticed that, oh, I'm finding it difficult to cope. I'm really stressed out. So that is when you have to act. Because when you fail to act, it means that you are now leading yourself up to have a mental health disorder. When we talk about mental health disorder, it is actually very broad. And then it has different categories. We have mood disorders, like someone that has bipolar.
Yeah.
Bipolar is where there is depression and then there is mania. Mania is when the person is so happy, so excited. It's not the normal kind of excitement. It is the one that, one characteristic of mental health disorder is that the problem is now so bad that it is now affecting your life. So for some people, before it gets to mental health disorder,
Mm.
they are having problems, they are having challenges, they are finding it difficult to cope, they are finding it difficult to relate with people, and then they do nothing about it. So when you do nothing about it, it can lead to a mental health disorder. One very common one, okay, is depression. Depression is one of those mood disorders. What is depression? Depression is that someone is in a state of low mood for at least a period of 2 weeks. So if you're having low mood for a period of 1 week, when you come, we just tell you, okay, you're having low mood, and then we tell you things that you can do about it. But now, once this low mood is now sustained, for up to a period of 2 weeks, then we can now classify that this person has depression.
So when it's like 1 week,
There are,
that is not
yes,
classified as depression.
no, when it's 1 week, it's not depression. So it's like that category of which I told you that, okay, someone has a mental health challenge,
Right.
but it's not yet affecting the person's life. Because lots of things can happen and then you have low mood for a short period of time and then you bounce up again.
In that case, you can't say I'm depressed.
Yes, no, 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 you're having low mood.
Okay.
Yes, at that point, you're having low mood. Remember that depression is not just low mood. There are other symptoms that
Mm.
we see that will be able to tell that somebody is depressed. So the one of them is low mood,
Yeah.
where the person's mood, if you were rating someone's mood from a scale of 1 to 10, usually it is 5 and below for a sustained period of time. Another one now is loss of interest in pleasurable activities. You know, as human beings, everybody has hobbies, if you want to put it that way. Hobbies
Yeah.
are just pleasurable activities, things that you do that brings joy and happiness to you. For
Right.
some people, it's watching movies. For some people, it's hanging out. For some people, it's playing games. So part of healthy lifestyle is that once in a while you should be able to do those things that you like doing. In depression, the person is no longer engaging in hobbies, is no longer engaging in pleasurable activities. That's one of those features of depression. Now, another one is sleep disturbance. And the commonest is lack of sleep. You're finished doing everything that you want to do in the day, and then you now climb your bed,
Mm.
trying to get sleep, and then you're not able to get sleep. Other ones are feeling of guilt. You just feel guilty. Something has happened, and then you just feel guilty or you feel worthless. You now get to a point that you feel that being dead is even better than being alive. Who have gotten to the point where they feel like it's better to die. It's not a normal thing to just stay and then you feel that I'm better off dead. That is now why people now have suicidal ideations, which is also part of those symptoms of depression.
Mm.
What boils down to the mind.
Mm.
The mind has found it difficult to cope with stress. And another problem too is anxiety. You're always anxious. Now there are people that normally they worry a lot. You know,
Mm.
we have different personalities, as I explained. Some people live a carefree life. They do what they want to do. They don't really care so much about the consequences. And then some people, like my kind of person, we worry too much. We want to prevent problems before they come. Now, we will not talk so much about personality, but we have lots of personality features. So anxiety disorder now is that it's the person is now having features of anxiety that it is
Right.
now affecting the person. You know, one feature of all mental health disorder is that it is now affecting the person's life. Let's say your family life, your work life, your relationship life. Because when you're having problems and it's not yet affecting your life, it's not yet a mental health disorder. You can say it's a mental health issue, right? You're finding your mental health is going through, is your mental health is down, right? You're going through a lot. So you have to act then because if you don't act, then you're going to end up having a mental health disorder. Another one is isolation. Isolation. You don't come out anymore. Before you used to come out to play football every Saturday with the guys. But
Mm.
now you don't come out anymore. You just go stay in the house. You don't even press phone. You're just mute, right? So now the truth of the matter is that everybody can undergo stress. Everybody is stressed out for one reason or the other. You know, in the clinic, sometimes I ask some patients, how are you enjoying Nigeria? And they are like, oh, they are stressed out. That who is not stressed out in
Mhm.
Nigeria? And that's true. Nigeria is a really stressful country. But now the question is, how how are you coping with the stress? You understand? How is this person coping with the stress?
Mm.
Everybody has stress. Everybody is stressed. So people now engage in good coping mechanisms, which is good. That is what we mean that someone has a good mental health. Person has good coping mechanisms and is able to adapt to his environment or to his workplace or to his family. And then the person is thinking right. has the right thinking, and then is engaging properly, having good relationship with people.
Hey,
And
doctor, before we go back to
yes,
stress, I want to talk about sleep. So for someone like
sleep,
me
yeah,
who work irregular hours, sometimes could be night,
yeah.
sometimes could be morning, and I can say one of the things I lack is sometimes good sleep. So it will take how long for you not having a good sleep to lead to a mental health issue?
Okay, it's not really fixed. As I told you, it varies
Mhm.
from people to people. For an adult, what we recommend is 6 to 8 hours of sleep consistently every day. And some people might, okay, you work at night, you could sleep in the daytime and then work at night.
Mhm.
However you want to do it, we advise that 6 to 8 hours of sleep is what is best, is what is
Within
good for
24
you.
hours,
Yes, within a
not
24 hours
necessarily
period.
night, right?
Night is preferable, but you not lots of people have opportunity to be able to sleep at night, maybe because of their work or because of environment or something. Take for example, people that work in the security system
Yeah.
where you have to be awake through the night, then you have to sleep in the daytime because the problem is if you work through the night and then in the daytime you're also working, after a certain period of time, for some people it takes weeks, for some people, it takes days. It varies from people to people. It's not fixed.
Mm.
There's no specific amount of days that we're going to say. When you have sleep disturbance for this certain period of time, it will cause problem. But it varies from people to people,
All right.
from days to weeks.
How do we manage stress?
Okay, yes, it's very, very important to manage stress. One of those ways of managing stress is being able to manage your sleep properly. In fact, managing your sleep is going to go a very long way in managing your mental health.
Mm.
It goes a very long way in managing your mental health. There's what we call sleep hygiene. Sleep hygiene are those things that you should do to ensure that you sleep normally at night. We, as doctors, we do not encourage people to be taking sleeping pills. Sleeping pills are addictive. You can get sleeping pills over the counter, but in the long run, it's going to do more damage than good. So, yes, sleep hygiene is one of those things that we advocate. Another one that we advocate is healthy connection. You should have trusted family members or friends that you can be able to talk with.
Mm.
Now, these are people that are not going to judge me because the moment people with health problems, with mental health challenges meet you and are talking to you and you start becoming judgmental, you've pushed that person further into the pit. So you should be able to listen to people without judging. That part of not judging is very important.
Okay.
Imagine you have a friend that is a millionaire and then he has a family, he has a job, has everything, and then he's now coming to tell you that he's not happy, that he feels sad a lot of the times, that his mood is low. Then you're now saying things like, why will you say something like that? You know how much is in your account? And yet you're saying something like, I beg, come up for here. No, that is wrong. Listen to the person. You have to be able to have good connections. Quality more than quantity. It's better to have 3 good friends, 2 good friends, 1 good friend than to have 100 people and then you cannot share
I'm finding them.
problems and challenges that you're having with them. And
Mm.
then it should also be able to help you, give you good advice because when people are having mental challenge, it's people around them that help out. So you should be able to help out when you see people having mental health challenge. Another one is now don't be too critical of yourself. What do I mean? People try to judge themselves too much. Imagine that you are somebody that you love. How are you going to treat that person if you love the person? Will you say kind words or will you say harsh words? Will you buy gifts for the person? Will you take care of that person? So now imagine that you are somebody that you love. How are you going to take care of you? We are just too harsh with ourselves. No, no, no. I should be happy. I should be this. No, I'm not feeling all right. What can I do? I can take myself out. I can buy pepper soup. I can go watch a ball. I can play games. I can call a friend that I like. You should treat
Yes.
yourself self-love. The
Yeah.
word is self-love.
Is there any evidence linking poor mental health to chronic conditions such as heart disease? And does it increase the risk of premature death or age-related diseases?
Yes, yes, there are lots of studies that have been carried out, and it has linked, especially depression, and other mental health challenges or mental health disorders have been linked to heart attack, stroke. But there's a group of syndrome we call metabolic syndrome,
Metabolic
diabetes,
syndrome.
cholesterol is very high. We call it hyperlipidemia, um, high blood pressure, and things like that, stroke. There are multiple evidence as regards that. But also, outside that too, it also causes death in the sense that For example, people that are depressed are prone to suicide.
Mm,
People, yes, they also die through other means, either putting themselves in harm's way by, for example, somebody can go and stand in the middle of the expressway. It's not all the time, it's not a mistake. The person is tired of life, just wants to die, and then the car crushes the person, and that is the end of that person. Yes, it is linked to heart disease, but even some chronic conditions like Alzheimer's disease,
yeah.
like yes, Alzheimer's disease that causes dementia. Some mental health people with mental health disorder are more likely to come down with things like that. Yeah, there are multiple studies on it.
Yeah. If I'm right, most of the major things that
Yes,
cause this mental health issue is stress. And one of the way to manage stress is how to control your sleep and manage the
yes, and
stress.
exercise cannot be overemphasized. Eating
Right.
healthy, eating healthy, and exercise, they are very, very, very important.
So you can
Exercise,
you can
eating
manage it through
healthy.
physical activity, like maybe improving your
Yes,
mood through physical activity.
yes, exactly.
Uh,
People that are depressed, they are usually isolated. They don't go anywhere. They don't. And then it is also good to know when to come, when it becomes too much. In fact, don't wait for it to become too much. Come to the hospital, meet mental health experts. We are
mm.
there and ready to help you, and we'll listen to you and we'll understand you. You don't have to wait until it's so bad.
Is there access to such in every hospital?
Yes, yes, definitely, definitely. I'm not sure about primary health centers, but outside primary health centers, any other hospital you go to, they have we have psychiatrists, we have behavioral psychologists, we have and so on. The list is endless. They help you handle day-to-day challenges, and then they are very, very nice people and non-judgmental.
Thank you, doctor. And if there is one single thing you have to say to people about mental health every day and repeating it, what would be that thing?
Yes, one thing I'm going to say is avoid negative coping mechanisms, things like smoking, alcohol. You're just
Interesting.
trying to numb. It does not. It will help you in the short run. That is the truth. But in the long run, it is not going to help you.
Mhm.
People want to forget their problems. They go and drink a whole lot of alcohol. They smoke. They numb their feelings and they avoid the problem. No, that does not solve the problem. You have to be able to face that problem little by little, even if it's little by little, that's fine. But if you avoid it, it doesn't solve it. It doesn't solve it at all.
Thank you so
Yeah.
much, doctor. Thank you so much. I appreciate you welcoming this invitation. Thank you so much. I appreciate that. Nice to have you
I'm,
here.
I'm happy to be here.
Yeah.
I'm happy